To KC Cares, Kansas City's nonprofit voice. We are telling the stories of Kansas City nonprofits and the people behind them. KC Cares is the intersection of the profit and the nonprofit community, making Kansas City a better place to live, work, and play. This KC Cares segment is brought to you by the Ewing Marion Kaufman Foundation, www.kaufman.org. I'm Ruth Baum-Biggis. One thing is certain, all of us must deal with death. And for many, grappling with the topic is difficult. And watching those we love go through it can be traumatizing. And this last couple of years with the pandemic probably brought that point home more than ever. However, there is an organization that can make this part of our journey more navigable and compassionate, and that's Kansas City Hospice and Palliative Care. So what does this organization do to help, and how do they do it? Well, joining us is President David Wiley. He's going to uncover all those secrets and all the great things that they do. David, thanks for joining us.
Thank you. I appreciate the opportunity today.
I think a good place to start might be just describing or defining for us hospice and palliative. I'm not sure everybody understands what that means.
Sure. Hospice and palliative care are really an important part of, can be of everyone's journey. And, a lot of times people think of hospice as just kind of the end of life and sometimes really right before death. But frankly, hospice and palliative care are intended to support families through a very difficult time, but also make the most of life. And we really work hard to support people who are facing a serious illness. And palliative care, or to palliate, means to make comfortable. And frankly, anyone can receive palliative care when they're seeking comfort at any stage of a disease progression. Kansas City Hospice and Palliative Care has been providing care and support to people for 42 years now. So since 1980, we're considered a legacy hospice. Hospice care, if we go to a real technical definition, which a lot of people that are on hospice also use Medicare. So Medicare defines the hospice benefit as a person who's terminally ill, that if their disease took the normal course, that you would expect them to die within 6 months. And so that doesn't mean that you can be on hospice longer than 6 months. It just means that there's certification processes along the way. And so oftentimes, we are able to help people longer than that time period, which is important for a lot of reasons. So
thank you for defining palliative care. I know just in conversations that I have, with friends and acquaintances, I think there isn't a great understanding of what that means. You've recently come to the organization. You haven't been there 42 years.
Right.
You're too young. But I'm wondering, can you share the robustness of what your organization is? You're more than just a hospice house.
Sure. Oh, absolutely. And, that's an important point because, hospice is not a place. It's interdisciplinary care of someone who is choosing comfort over curative care. You're right. I've been with Kansas City Hospice now for 8 years. 6 of those years I've been the CEO, and it's an honor and a privilege to support nearly 375 staff members every single day, taking care of people across our community. Hospice care, which of course we're very well known for in the community, means that we can provide hospice in someone's home, which is really the bulk of where our patients are across the community. More than 300 patients that are in their home, where our nurses, our clinicians, our social workers, our team are visiting them and caring for them in their home, or really supporting their family who are caregivers, frankly. We also are very fortunate to have 2 inpatient hospice houses. One is called the Kansas City Hospice House. It's located at 120th and Warnell Road. And it was the first inpatient unit in Kansas City and also in the state of Missouri. It's been in existence now for 16 years. We offer a beautiful setting. There's 32 beds in that facility in order to take care of folks. And we also have a North Care Hospice House, which is located inside North Kansas City Hospital. And it's in a separate dedicated unit, and it has 16 beds. So we're really proud of our ability to partner with North Kansas City Hospital and their commitment to the continuum of care. And besides hospice in the home, we have hospice that's provided inside long-term care facilities. So when families, when their loved ones are approaching the end of life, then we partner with them, but also long-term care communities or nursing homes in the city. And we have a lot of patients that are in that setting as well. So that's hospice care. We provide palliative care, like I mentioned. One thing that's unique about us is we provide what's called palliative home health. So these are folks that are terminally ill. They have a skilled need, but they're not quite ready for hospice. In fact, typically they're still seeking curative treatment. And so think of maybe a cancer patient that's starting chemo. They need help in the home. They have a skilled need, but their goal of care is curative in nature compared to comfort. And so that's really the difference for us. We have an advanced illness support program, which is sometimes people don't have a skilled need, but they need palliative care. So it's a nurse practitioner driven program where our nurse practitioners can go in the home. They stay connected with your primary care physician. They help navigate kind of what's going on. And then as things change, we can help get them to the right program, whether it's palliative home health or maybe hospice. So just really kind of becoming part of someone's life when they have a serious illness, but sooner rather than later, to be able to provide that extra support. So those are really two of the big care offerings that we provide, and then we have some other things that we can talk about related to grief and children's programs if you want.
Absolutely, there's so much there. I just in prepping for our conversation today, I was just amazed. And full disclosure, our family was touched by Hospice House. My father-in-law was in Hospice House prior to his passing. And it was, I have to say, a very comfortable, comforting place to be with, particularly dealing with age. And by that, I mean, we had the adult children, and then we had our children who ranged in age from about 10 to mid-20s. So I think that gives us an opportunity to talk about what you all are doing and able to do in embracing kids and this whole issue of terminal illness, death, dying.
Yeah. It is an important aspect of what we do. And I think our clinicians who are experts in this work, they understand what's going to happen. And they help from an anticipatory grief perspective and of people of all ages. One of the care programs that we have, which sometimes it's hard for people to conceive, but we have a pediatric hospice called Carousel. Carousel is our pediatric hospice team, and nobody wants to think about pediatrics and hospice. But when you need an expert, that's exactly who we are. And we've been doing that great work since 1989. So, then that really extends on to some of our grief support and counseling programs. We offer tremendous support to children, like you mentioned. We offer a couple of camps in the summer where children can come, Camp Aaron's in the summer, and kids come to a really fun weekend of camping with lots of activities, but also receiving grief support, and they leave that weekend realizing they're not alone in their grief journey. And then we do the same thing in the fall for families. So you come as a family unit, and it's called Camp Carousel. And it's exactly the same thing when there's a death in the family. And sometimes, or a lot of times these families have experienced very tragic deaths. It's not related to hospice necessarily. And so this is free to the community. And it's really brought about because we have tremendous donors that help support the great work we do as a nonprofit. So I like to talk about that. And then finally, that we have a Center for Grief and Healing called the Solace House. And it's been a tremendous resource for Kansas City for nearly 25 years. And it became part of our scope of services in 2009 because we realized, the value and the benefit to children and young people and adults too that are facing. They need a place to go to help with their grief, and so this Solace House is a place that families can come. And we offer a couple of semesters of grief support groups that are a series that's well designed, that's helped. We have some full-time staff, but executed by tremendous volunteers that are well trained in order to help people through their grief journey. So
I wanted to go back to, you mentioned that you're a nonprofit.
Yes.
KC Cares is all about nonprofit. Can you talk about why that is the route for your organization? Because there are other hospice organizations that aren't nonprofit. Why
Correct.
Nonprofit for you all, and the pros of that?
Sure. You're right. There's 40 hospices in Kansas City, and there's just a small number that are nonprofit. And we happen to be the largest nonprofit in the city, and that's based on the number of people that we care for across our programs. For me, it speaks to who we are and why we're doing this great work, which is really to be there for the community, to reinvest in the community with programs that have been developed over the last 42 years. And we're not trying to earn a margin to pay an owner or to pay a company or to pay a dividend or to pay private equity firms, which are now really getting into hospice. So that's who we are. And one of the greatest things about being a nonprofit is that we provide charity care, nearly $600,000 a year, in people who don't have any resources, and we don't turn people away if they don't have insurance or Medicare, and I think the beautiful thing, and you said you've been to the Kansas City Hospice House. I think what's incredible is that you can be the pillar of the community in room number 1, and you could be a homeless person in room number 2, and you're going to get the same expert, beautiful care that all of us deserve. And so it's, but being a nonprofit and working with donors who understand the impact that we make is tremendous. And it's very fun. It's a fun aspect of who we are.
I would never have associated fun with hospice. So that's an interesting connection there. You've mentioned the pros of being a nonprofit. What are the challenges, though, of being a nonprofit and being in this kind of care?
Sure. So the fact that 85% of our patients are on Medicare means that we're dependent upon the government in setting the rates that we receive. And so one of the hard things is that reimbursement collectively does not pay for what we understand as an end-of-life expert provider, what it takes in order to make that a beautiful experience. And so that's the hard part, I think, is just making sure that we, all of the ideas and things that we know that we should be doing and can be doing for the community are funded somehow. So I think that's just hard. I mean, sourcing funds is just a challenge. I call it fun because, anytime you can match a passion with a donor to a need we have, and they find joy in writing a check, then we'd like to do that, all day long. So.
We're talking with David Wiley. He's president of Kansas City Hospice and Palliative Care. So we've talked about challenges. We've talked about, the benefits and the pros of being a nonprofit. You have 300 plus employees. That must be quite an undertaking to try to balance everything because you are also public forward facing.
Mm-hmm.
How do you do that?
Well, part of our strategic plan, we have, besides quality, the number two pillar is people. And our strategy this year, a big focus area in 2022 is to focus on caring for our people. And so we work really hard to engage our teams in a really robust way. We use Gallup as an engagement tool in order to understand how can we be better? Where are the things that we're doing great that we need to continue doing? And then what are the opportunities? We have tremendous managers across our team that really work hard. This is a difficult job. I think you're called to do this work in terms of, being able to think about it. And people tell me sometimes, I don't know how you do it. And I think if you've been through it, like we have with our families, and that's how I became connected to Kansas City Hospice, was through my mom. I think you understand how important it is. And, we're all going to die. Our culture isn't comfortable talking about death, but we need to be ready, and we understand how important it is to be ready for those very precious and important moments in each person's journey.
So it was a personal connection for you?
It was, yeah. My mom, she died at the Kansas City Hospice House in the fall of 2011. She was there for 9 days, and it was a beautiful experience. I'm the youngest of 6 children, and the opportunity for us to be with her while she was really well taken care of, and be her family in those last 9 days was tremendous, and a real blessing, frankly.
Well, thank you for sharing that. We appreciate that. You're talking about your staff. It's really a diverse staff. You've got clinicians. There's people who have to clean the rooms. There's people going out into others' homes. Can you share with us a little the training everybody receives? Because you are dealing, no matter what your role is, with a subject that, as you said, many of us are still not comfortable with.
Yeah. When a family entrusts us to take care of their loved one, and they sign on to hospice as a benefit, we're responsible for their medical care. And that comes with, we have full-time employed physicians, we have nurses, we have social workers, we have chaplains, we have certified nursing assistants, or CNAs. Sometimes people call them home health aides, that are the interdisciplinary team that is supporting that family. But then it goes even beyond all of those. Just like you mentioned, it takes everyone to do this hard work, which is the behind the scenes folks, medical records, billing, all of our wonderful receptionists, the people that answer the phone, to really come together as an entire team in order to make all of it happen. And so a lot of diverse experiences in order to bring various levels of expertise to make sure that that we make this look easy, which it's not. Frankly, one of the tough things, I should say, whether you're a nonprofit or not, the regulations related to hospice and home health are quite rigorous. And we take that very, very seriously, and to make sure that we do it not only with high quality care, but that we do it well and with high integrity.
So we got to bring in the big P word, the pandemic.
Sure.
How has KC, or Kansas City Hospice, how have you maneuvered in this world? And there's with your patients, with your visitors, with everybody.
Yeah. Let's see. I think, like everybody else, we took it one day at a time. it's daunting to reflect back sometimes about all of those moments that were extremely difficult. I think the number one thing that we worked really hard to do was to protect our employees, to ensure that they had the PPE, the equipment that they needed in order to protect themselves. We had to rely on the community to help source some of those things. And frankly, it was not easy. Honestly, it wasn't. But I think making sure that we had the clinician in mind, the frontline team, because our teams were still going into homes every single day. We were still helping people because death didn't stop, and people that were getting ill didn't stop. Whether it was COVID or not, we had to be ready and there. And then, we did a lot of great work with telehealth, for example. I think in February of 2020, we probably had never done a telehealth visit, and now we do thousands of them. And people have just been tremendous. I think helping, supporting our staff, making sure that they knew how important it was, that we were communicating frequently was crucial. And then when the vaccine was developed, we became an improved vaccinator, and we helped not only the community but other hospices and our staff get vaccinated as quickly as we could.
Well, you did mention pandemic positive there, the fact that you'd never really done a Zoom or any kind of a virtual thing. And now I think for many, not just nonprofits, but any organization is like, wow, we should have known this before. We could have, been so much more efficient or saved this money, et cetera. But it's something that I think has benefited a lot of nonprofits, ourselves included. With the webcast, we were able to continue, albeit virtual and being safe. I do want to ask you about the important role it appears that you have for volunteers. How do you utilize volunteers?
It's such a great question, and I love that. We are terrific as a company because of our volunteers, and we have more than 300 volunteers that help us do this great work. And the opportunities range from, providing patient and family support. So we have volunteers that help, let's say, a wife who's caring for her husband, once a week from, 1 to 3 needs to do errands. And so we have volunteers that will sit with patients. We have volunteers that help us in a variety of capacities, both with patients and also behind the scenes. So we have some administrative volunteers. When the hospice benefit was created in 1982, part of that was that you needed to have 5% of your care hours provided by volunteers as a way to help offset some of those costs. And I'm proud to tell you that we double that percentage frequently. That's how lucky we are, because people who have experienced this great work understand the impact, and then they like to give back. And so we have tremendous volunteers that help us across, like I said, a lot of things. And we have a great board of directors as well that are all community-based and fantastic.
What do you look for in a volunteer? I mean, is this something for everybody?
We look for, a variety of things. I think sometimes every person, I think, can bring something obviously to the table. So we have nurses, we have doctors, we have teachers, we have fundraisers, we have business people, lawyers, so really every discipline and philanthropists, people that are part of the community to help us make connections. And so I think the diversity of experience is really important to us, and diversity of backgrounds is a big focus for us right now as we think about diversity, equity, and inclusion, and ensuring that we're representing the community that we serve, not only in our staff, but in our board, and also so that we can really address the community, in a great way.
where's the best place for people to learn about what you're looking for in terms of volunteering or other support?
Sure. We have a great website, which is www.kchospice.org. And there's volunteer page, there. It talks a lot about, it's really a robust website. It talks about end of life issues, grief support. We offer free grief groups to the community as well. Or people can always call us. Our phone number is 816-363-2600. And that number's on the website also. And we'd be happy to have somebody call, and one of our great receptionists will make sure that your call gets to the right team.
Yeah, you have a plethora of information. I could have spent hours going through everything on there. So it's great that there's that much there for people to look and hone in and see where they may fit, whether it's a volunteer or see if they can take advantage of the great programs and services you. Do you do programming out in the community, kind of beyond the intermediate people that connect with you?
Sure. Particularly a couple different ways. We offer an education series that people can sign up for on a variety of topics throughout the year. And we do that via Zoom just because it's easy for people to do that right now. Our Solace House and our grief support team, they oftentimes are leveraged or tapped when there is, a tragedy happening in the city, whether it's a shooting or a school shooting, or I remember, a teacher, a very young teacher died over a weekend one time, and the school reached out and we were able to have people on site, at 8:00 in the morning on Monday to help not only, the peers, but also for the students. And so supporting the community in that way is great. And then we love the opportunity to talk to groups in order to help people understand what is hospice all about. And I always urge people, learn as much as you possibly can, because it's difficult when you're in a crisis situation in order to figure this out. And healthcare is very complicated, period. I know people know that. So I just urge people to learn as much as they can about this great opportunity if you ever need it.
And your website is a great place to start. We only have a couple of minutes left, and I do want to share, you do have a big fundraiser coming up in October. Mm-hmm. That sounds interesting. Give us a little tidbit of that, and then we'll send folks to your website to learn more.
Okay. It's called Sunday Night Live. It's October 2nd down in the live block down at KC P&L. It's a fun 5 to 8 o'clock in the evening event where, people can come together, support this great organization, learn more about us, and have fun. There's, food, drink, and games. And so we have a tremendous committee that is helping us with that. And it's our largest fundraiser of the year. And it really helps us be able to do this great work, particularly for programs that are free to the community, or charity care is another big thing that's important to us to raise money for as well.
Well, the work that you do is incredible and so important. And while as you mentioned, it's a difficult thing for many of us, but it is part of that journey. And I can just tell by talking to you and your enthusiasm, the joy you have for, leading this type of organization to really help all of us. Something that, what do they say? You can't avoid death and taxes. So we thank you for helping us at least get through, the one part of the journey.
Exactly. Well, I appreciate it. It's an honor. And we welcome anybody connecting with us to learn more about us and to see what we're all about or to provide you information. Okay.
Thank you. And thank you for joining us for KC Cares, Kansas City's nonprofit voice. We're produced by Charitable Communications, which is also a nonprofit. This KC Cares segment was brought to you by the Ewing Marion Kaufman Foundation, www.kaufman.org. To be a guest on KC Cares or underwriting opportunities, visit our website, kccaresonline.org. And spread the love. You'll find us on Facebook and Twitter at KC Cares Radio and on Instagram at KC Cares Online. Catch us Saturday mornings at 8 a.m. on ESPN, 1510 a.m. and 94.5 FM. Thank you for joining us on KC Cares.